Hi, I'm Jack Rowe. I'm a med peds physician here with the MGPO, and I'm excited to be here in the Lawrence Center for Quality and Safety today with Liz Mort, the Chief Quality Officer, and Claire Seguin, one of the Associate Chief Quality Officers, and we're going to talk to you today about regulatory readiness. So, Liz, do you want to talk a little bit about our approach at MGH to regulatory readiness?
Thanks, Jack. Yes, I'll be happy to give an update on how we approach regulatory readiness at MGH and MGPO. We actually call it excellence every day, and for the last several years, we've been not preparing for the next survey, but we've been preparing for the next patient. And on a weekly basis, we have multidisciplinary teams going out to the patient care units and giving everybody a briefing on what's most important in regulatory preparedness. And we consider that a very, very high reliability approach to making sure we're ready not just for the next survey, but for the next patient.
Awesome. And can you talk to us a little bit more about some of the specifics that you guys do in your tactics here?
Well, what I would say is that our clinicians, many of them have been involved in the Excellence Everyday Tracer program that I was just referring to. And I would say most of our clinicians really know how to do this. We embrace quality and safety, we understand safety science, and I'm sure that if the Joint Commission were to come today or 6 months from now, we would do very, very well. But we'd like to take this opportunity to give you a few examples of things that are really of strong interest to the Joint Commission. So let's start with mask hygiene. Claire is here and wearing a mask. You might
Yes.
wonder why. So Claire's going to give us some tips on best practice for mask hygiene. Claire.
So this is how a mask should be worn when you're walking around the OR or places that require a mask. We ask that it's either worn like this or it's in the trash. So just to show you an example of that, here you go.
Excellent. So the take home there is if you're wearing a mask, put it on properly, but if you don't need it anymore, get rid of it right in the trash. Another tip that we just want to remind everybody about is the importance of 2 patient identifiers. So if you are doing anything with the patient, giving them a medication, taking them for a test, about to start a procedure, each and every time we have to check on the 2 patient identifiers safety practice. Claire's going to demonstrate. Let's pretend I'm a patient and Claire's about to do a procedure on me.
Elizabeth, welcome. You're here today to have a lumbar puncture. I'd like to check your name band if you don't mind. Could you confirm your name and date of birth?
My name is blank, 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 and my date of birth, well, we can leave the demonstration right there. Thank you, Claire.
You're most
Now, if I
welcome.
was a real patient, I would actually tell her what my date of birth is, but I don't need to share that with all of you. The third thing we want to make sure that everybody is aware of, and I know we do this so well at MGH, is just your basic hand hygiene practice. Use hand hygiene practice before and after patient contact every single time. The basics. The last tip we have is about timeouts. Whenever there's a procedure done to a patient, a timeout is, again, basic safety science practice. Claire has a great tagline. Claire, can you share that with us? What's the bottom line on timeouts?
Nothing starts until we all stop. So everyone in the procedure room should stop, pay attention, and participate in the timeout.
Great. Nothing starts till we all stop. So in our Excellence Everyday world, we're looking at these things on a continuous basis, every week, year-round. That's just a brief reminder of 4 things that we just want you all to be thinking about in your care of patients.
Wonderful. Thank you guys for talking with everyone. In summary, are there key takeaways that you would like people to come away with?
Well, you know, when the Joint Commission does come on site, and if clinicians are seeing surveyors come on site, engage with them. In fact, in past surveys, what we've really heard as take-homes from the surveyors is how impressed they are with our doctors and our nurses who come up with the surveyors, engage with them, and tell the stories that they're so proud of about their patient care. At MGH, we have this. We'll do well when the Joint Commission survey happens.
Absolutely.
And this is just a brief reminder of how Excellence Every Day is business as usual at MGH. And thank you so much, Dr. Rowe, for coming and interviewing us today.
Thank you all.
Thank you.
Thanks.